Hey, what's up, everybody? I have been missing in action. I apologize. A lot has been going on. There's going to be some changes with my YouTube channel, as most of you have seen. It's now called iRise, which I'm going to be talking about my lifestyle, therapy, as well as motivation. But I did have a special request from Miss Paola Garcia. I hope I said your first name right. Yeah. So I do apologize for being out of the scene. I got married, bought a house, and now I am expecting our first child. So I am officially 9 months pregnant, about to pop soon. So I'm going to get right to it. Miss Garcia, so you wanted to know, and forgive me if I keep looking over here. I just want to read your email you sent to me. So pretty much for parts 2 and 3 for the arm strengthening video, that's going to take me a little while to get to. I'm probably not going to do that for a while, but I did want to answer your question that you had about what do you do with patients that are, I believe you said, let's see, you said, any ideas for treatment for patients who are bedridden, lethargic, or advanced in age? Treating for me is not a problem, but when it comes to documentation and progress notes, it is hard to write. Okay, so I will answer that question. Now, there's a lot to that question because every patient is different. So the best thing I can do for you is I created a mini case study, and I'll go through it so you can see kind of how I would handle that situation. All right, so this is the first one. I did 2 for you, Miss Garcia. Okay, so the first one, it says, so case study number 1, John is a 75-year-old male with history of HTN, which means he has high blood pressure, DM, which is diabetic, bilateral hemisphere CVA, which means he has both sides, was affected from a stroke 2 years ago, which caused him to be bedridden. He is total dependent for all ADLs, and he has a stage 4 sacral wound. Okay, so this is our patient, Garcia, Miss Garcia. This is our patient. All right. So the issues that we got to look for, or I should say, we have to think about, is we already know that he has bed sores, so that's the wound. We have to think about circulation, because if he's bedridden, he's not moving on his own. Okay, so that's already got us thinking about range of motion, which in the goals should have some form of range of motion goal to prevent contractions, which leads me into contractures. So you're thinking about some splinting. Respiration, I didn't put that in the case study, but we need to know, is this patient able to breathe on their own? If not, is this person on ventilation, etc.? Okay, so we got to look at oxygen. Is this patient verbal, nonverbal? I know your question was lethargic, so most likely the patient is probably nonverbal. So we may be able to get some facial grimace, some eye movement, but maybe they're just not able to talk or really communicate. So we got to look for signs of behavioral changes with depression and, their interaction with us and the things that we do. And then nutritional intake. If they're on a G-tube, if they're able to swallow, they're most likely going to need to be fed. So they're probably a feeder. And then we need to think about if there's any kind of adaptive equipment that we can support them with, which in this case we probably need really advanced equipment. All right. So I kind of told you what are the issues that you're going to be looking at before you even meet this patient. As a therapist, when you're going to the room, you're already thinking about these things. Now, I don't know if your patients are patients you've had for a while, or these are patients that just came through the door through evaluation. Um, but those are a, those issues are a good start into that case. So we already know that this person probably had really high blood pressure, and from that caused them to have a universal stroke, which is both hemispheres. And when it happened, it was such a long time ago, 2 years, so there was a lot of damage. So probably when they came to you, now they're bedridden and they have a really bad wound. So before I go into some treatment notes, I want you to think about what could you possibly do for a patient in this situation. Now, you told me that your treatments are fine. You don't have a problem with your treatments. It's really your documentation and progress notes. I can't really comment too much on the progress notes because it really depends if you're an OTR or if you're a CODA, and how your OTR is writing their goals for you to be able to comment. So if you have an example of something that you've seen, I would say write it down and then send it to me, and I can tell you how you can go about writing in the information you need on your progress note, your progress report note. Because that's a little bit hard for me to, tell you without knowing what the goals are. So what I'll do is I'll give you an example on how I would write a treatment note, and that might be able to guide you along when it comes to your progress reports. And like I said, every therapist is different. So whatever your OTR, or if you're an OTR, whatever you decide to write for your progress notes, that's what's gonna help you when it comes to your treatments and guiding through your treatments. All right, so I don't want to make this video too long, so I'm gonna get going. So the way I would write my first note is depending on how much time I have with this patient. If it's 30 minutes, 45 minutes, an hour, I don't know. But I just decided I'll write a couple of options for you. Okay. So the first one says, patient guided through PROM, which is passive range of motion of both upper extremities. I usually hyphenate my stuff. Yeah. Patient guided through passive range of motion for both upper extremity in elbow flexion / extension, shoulder flexion / extension, and shoulder ADD / abduction, 10 repetitions times 3 sets, with intermittent rest periods incorporated as needed in order to decrease risk of further contracture, promote joint flexibility, and maintain skin integrity. So that would be my range of motion goal. Okay, you can kind of, word it differently if you want, but that would be my first treatment note regarding range of motion, because whenever you have a patient that's bedridden, it is important that you have a range of motion goal. Okay. So here's another option, another documentation note you can write. You can either put patient instructed if the patient is kind of communicating with their eyes, or you're getting some gestures, or you can say patient guided. It's up to you. But I'm going to write patient instructed in bed mobility. Rolling towards right / left sides for pressure distribution and